What is lumbar spine problem? Lumbar spine comprises of 5 vertebrae labeled L1, L2, L3, L4 and L5. These lower spine vertebrae support the entire vertebral column. With the sedentary lifestyle and change in physical habits, lumbar spine problems or lower back problems are becoming very common. The problems can range from low back pain to sciatica to radiating pain, and some other conditions like tumor and fractures can also affect the lumbar spine. In this video, we will discuss what is lumbar spine and what are the common problems that patients face in the lumbar spine area. Hi, I am Dr. Varun Agarwal, a robotic and endoscopic spine surgeon practicing in Bareilly, Uttar Pradesh. I have been trained in Germany and Switzerland, and I bring these advanced technologies and techniques and the latest information about spine disorders and techniques of spine surgery to you. Don't forget to like and subscribe and hit the bell button to get regular updates on our channel. One of the most common conditions faced by patients is a slip disc or a herniated disc. When the disc between the two vertebrae bulges out, this bulged portion compresses the nerves and causes pain. This is called a slip disc, which causes a common condition known as sciatica. This herniated bulging disc compresses the nerve and which causes a shooting pain which goes from the lumbar spine and radiates down the leg even up to the sole and the toes. This is known as sciatica. Degenerative disc disease. With the increasing age, there is natural degeneration which occurs in the body, including the vertebra, the spine and the nerves. Because of this natural degenerative process, the vertebral bodies come near to each other and they start compressing the spinal cord and the nerve roots, which can cause pain. This leads to degenerative disc disease. Spinal stenosis is a condition in which the narrowed spinal canal compresses the spinal cord and the nerve roots, which can cause symptoms like pain and claudication, in which the patient has a feeling that there is weakness or numbness in the legs. Spondylolisthesis is a condition in which one vertebra starts to slip over the other vertebra, causing compression of the spinal cord. Lumbar strain is a common injury which occurs due to excessive strain on the lower back, causing ruptures of some of the muscle fibers and which causes immense amount of pain. Stretching of these ligaments and muscle fibers leads to pain. Localized pain, muscle spasm, limited mobility in the back and stiffness in the back are common symptoms of lumbar strain. Osteoarthritis of the lumbar spine joints leads to painful joints, and they also can lead to lower back pain and spasm in the muscles. Osteoarthritis of the lumbar spine joints also leads to reduced mobility in the lower back. Several factors can cause problems in the lumbar spine, such as increasing age. Increasing age can cause natural wear and tear in the lumbar spinal area. Apart from this, injury such as trauma, fall from heights or even roadside accidents, patients can hurt their lower back, causing problems in the lumbar spine. A family history of spine issues can also predispose a patient to lower back problems. Obesity is another common cause for lower back pain. Excessive weight can put extra stress on the lower back muscles, and reduced core muscle strength can also put extra stress on the lower back. All this can become a chronic cause of low back pain. Sedentary lifestyle and lack of regular exercises which weakens the supporting spine muscles, and this can lead to chronic back pain. The symptoms of lumbar spine can vary depending upon the underlying condition which is causing the lumbar problem. Symptoms can be lower back pain, which can persistent or intermittent low back pain is a common symptom of lumbar spinal conditions. Radiating pain, which is a pain which starts in the lower back, then radiates from the hip to the back of the leg and even up to the sole and the toes, is another common symptom. Numbness and tingling sensation with a feeling of pins and needles and a pin prick sensation in the distribution of the nerve is another common symptom. Weakness of the muscles, a feeling of weakness in the lower limbs, a reduced walking distance with the patient feeling that he will fall if he goes on a long walk is another common symptom which is associated with lumbar spine problems. Limited mobility and stiffness in the back is another common problem which is faced by patients. Patients need the latest and most credible information. I, Dr. Varun Agarwal, a robotic and endoscopic spine surgeon, bring to you the latest information on spine diseases and latest information on advances in the field of spine surgery. Don't forget to like and subscribe the channel and hit the bell button to have regular updates whenever we upload a video. Diagnosing lumbar spine problems involve a thorough medical history of the patient, physical examination of the patient, which can be followed by some investigations such as X-rays, MRIs and some blood tests to pinpoint what is the exact cause which is causing the pain and other symptoms in the particular patient. Treatment options depend upon what is the underlying condition which is the cause of the lower back problem in a particular patient. These can be conservative treatment in the form of medicines, physiotherapy, cold or heat therapy, interferential therapy, some regular exercise program such as pranayam, yoga or some other core strengthening exercises. Some patients may have to take medicines such as non-steroidal anti-inflammatory drugs such as ibuprofen, paracetamol, diclofenac, etc. or anti-inflammatory like corticosteroids, muscle relaxants and other painkillers of the opioid variety such as tramadol, etc. may have to be taken by patients who are not getting relieved with simple NSAIDs. Always remember to take any medication in consultation with your doctor after a thorough clinical examination has been done by the doctor. Never take any medicine without prescription of a qualified doctor. If the patient is not relieved by any conservative or pharmacological treatment, he may have to consider surgical options. The surgical option will depend upon what is the underlying condition and may include surgeries like discectomy, endoscopic discectomy, minimally invasive discectomy, microdiscectomy, or other surgeries such as laminectomy, spine fusion surgery, and these days even artificial disc replacement of the diseased and ruptured disc. Don't forget to check out our other videos on the subject.